Welcome to Overview of Assessment, Tools and Strategies. In this segment, we are going to be looking at understanding assessment, specifically thinking about the varied purposes for assessing and observing children. Assessments are designed to serve specific purposes. Assessors need to be sure that they're using an assessment instrument for the purpose it was designed to address. Terminology used in the assessment field can be overwhelming, so it's important to be knowledgeable about those commonly used terms. Different assessments come with their own procedures and administration directions that must be followed. It's very important that anyone who is administrating an assessment has had appropriate training and follows administration procedures carefully. One important use of assessment has been mentioned earlier is to inform decisions about curriculum and teaching. In order to do this effectively, the assessments being used must line up with curriculum in the classroom and should line up with your outcomes framework that your school is using. There are a variety of purposes for child observation and assessment. Let's take a look at a few. One purpose of observing and assessing is to quickly identify children who may need a more thorough evaluation by specialists. In particular, the process of screening helps to determine which children may have developmental differences that put them at risk for learning difficulties or school failure. If the process of screening and/or teachers' ongoing observations and assessments of children create concerns that a child may benefit from special education services, assessment by a team of professionals should follow. This team will then determine whether the child has a disability and how to help the child develop and learn. The most widespread use of observing and assessment is to help children develop and learn. Teachers observe and assess children to find out what they know, what they can do, and really what interests young children. Teachers then use this understanding to better plan meaningful curriculum, meaningful learning activities and experiences, and to select the materials and environmental design. A final purpose of child observation and assessment is to evaluate whether the program is effective in helping children learn, all children. Information about program effectiveness is of value to program administrators, families, and the teachers of young children. Now let's take a look at the types of assessments that we might see in early childhood education. Teachers of young children need to be familiar with a number of types of assessments and assessment tools. It's important to use assessment tools only for the purposes which they were designed. Screening is a brief assessment used to identify whether a child needs further evaluation. The goal is to assess a large number of children in as efficient a way as possible. Screening will not establish that a child needs additional services. Instead, it alerts us to the need to look more closely. Hearing screening is used to determine which children need a more thorough examination of their ears or their hearing. A vision screening is used to determine whether or not children need a complete vision exam. Health screenings, such as those that check children's blood lead levels, identify children's health issues, may need additional evaluation. Developmental screenings identify which children are developing as expected along a typical developmental continuum and which children may have a developmental delay. And it sometimes helps us to understand if we need to be suspicious of a disability. Those who may have developmental differences need follow-up evaluations by a team of trained specialists to determine whether or not the delay in development may require special education services. Another type of assessment of learning and development, is a thorough ongoing process used to determine what a child knows and can do. The goal to observe and document children's skills over time is important to the teaching instruction. Teachers use this information to determine how best to develop children's activities, environment, and to help them learn. Assessment of learning and development can be divided into two categories. Formative assessment, how is the teaching going? How is the learning going? And summative assessment, was the teaching effective? Was the learning sufficient? Formative assessment takes place as teaching and learning occur. It happens within the context of when children are actually involved in the process of learning and the teachers are teaching and the teachers are adjusting to respond to the children's behaviors and needs in the teaching process. Summative assessment takes place at the end of a period of teaching, such as at the end of a school year, at the end of a unit, and summarizes the progress that children made during the year or during that unit. It is not very common that in early childhood classrooms, such as pre-K, kindergarten, first grade, second grade, that we have summative assessments. A final type of assessment often is encountered by teachers of young children, and that is diagnostic assessment. A team of specialists carries out an extensive evaluation of a child's learning and development using multiple methods, multiple tools, and many sources of information. Diagnostic assessment is intended to answer a number of questions, including, does the child have a delay or a potential disability? Is the child eligible for special education services? And if so, what services might be helpful to the child to develop and learn? We will share with you a schedule of screenings some states have prepared, such as the state of Wisconsin. We think about newborn conditions, maternal depression, vision, hearing, blood levels, developmental screenings. Those are recommended screenings that are on the handout that is attached to this content folder. Screening that follows this kind of schedule is most useful when accompanied by ongoing surveillance by parents, caregivers, and professionals. Parents often talk about these things with their pediatricians or a home visitor, and if their children are involved in early education and care settings, then parents and teachers are often discussing potential need for screenings. Let's think about formative and assessment, summative assessment. Direct assessment instruments are administered by specific procedures. In contrast, observational instruments are completed based on observations of children during their typical daily routines. An example of a direct assessment comes when we think about a developmental screener for young children that might go with a particular curriculum tool, such as Teaching Strategies Gold. Other types of curricula materials may also include a direct assessment, such as the DIAL, or you might have heard of the Brigance tool. These are direct assessments that are standardized across groups of children. Diagnostic assessment is typically carried out by a multiple disciplinary team from the agency that's going to provide the early intervention or special education services. Sometimes children will go to pediatric care, Children's Mercy Hospital, for example, and they may go under some diagnostic assessments with practitioners there. It could be an LEA, so an individual school district has this multiple disciplinary team that will help with the diagnostic assessment. So let's think about why is child assessment important? Well, it's important for many reasons. If we think about this quote of understanding, if we knew what you were going to use the information for, I would have done a better job of collecting, right? So we think about that it's very, very important that assessment is helping us to know our children deeply, to know what their needs are, to know what their strengths are, so we're sure to create a strengths-based environment. But we also have to think about important components related to collecting data. And so we really need to make sure we collect data in a very careful way so that we're collecting reliable and valid data. Purposes for assessment may vary. We want to think carefully about that. From time to time, program evaluation is driving our goals. So the program wants to improve teaching, and so we're looking at specific things such as school readiness goals for children. In pre-K settings, we want to help them really be prepared for kindergarten. So those might be the goals that are driving some of the purposes for assessment. We might be thinking about professional development for teachers, so such as using the class tool to observe teaching to help us know if the program is improving. And then to support learning, we may be thinking about the child progress that's essential across the domains of learning and how to involve different teaching practices to get the results to support those learning or involve the family within the process. There are many important terms related to child assessment. Norm reference means that the children's scores are compared to scores from the norming group. Norm references assessments are used to answer questions about how a child's performance compares to other children of the same age. Criterion reference is all about the skill or the desired level of learning. It's a particular ability. Criterion reference assessments are used to answer the questions about how a child is performing compared to a standard or an outcome, such as how is the child compared to meeting literacy skills for a kindergartner if it's a 5-year-old child? For children in 3rd grade in the state of Missouri, they take the MAP assessment test, and that is a criterion reference test versus a norm reference test like a STAR literacy test would be a norm reference test. Standardized assessments have a set of directions for asking questions, a way to set up a task, and scoring responses. That's part of the standardization. And we have to think about how these must be followed to interpret the results as prescribed by the publisher. That's very important. But also we have to take in context the child and the age and the learning experience, because we can misinterpret standardized scores when there are cultural or linguistic differences. That's very important to consider. Observational assessment is the most direct way of gathering information about young children, observing intentionally, watching the children, talking with them, asking them questions, listening. That helps you get authentic information, especially during everyday routines that happen on a typical ongoing basis. And you can do this for almost any area of development. Parent report is an indirect source of information about children. Parents' perspectives are very important, and they hold a special value because parents do know their children well, and over a long period of time they're able to really see the change in children that perhaps we cannot yet understand when we first get to know children. There are some terms related to specific aspects of assessment and making sure that we have good data. Like the quote earlier, if I really knew all I needed to know, I would have paid better attention, right? So when we're thinking about really taking careful, systematic observation and assessment, we have to consider the following. Young children are often a variable in their performance. They might be still learning and developing, and the context changes or something happens. They may not be as interested, or some days they're more comfortable than others. So as we think about developmental assessments, we want to make sure that we develop an instrument that results are reliable, which means the results are consistent over time when done by one assessor or another. If it's reliable, we can trust the scores. But if the scores are shifting from day to day or from assessor to assessor, then that means it's not a reliable tool. And for research purposes and for program evaluation and for everyday assessment, reliability is important. Then there's validity. So assessment developers also want to be sure that the information gathered is valid, which means it was intended to be measured. So it assesses what it intended to measure. So for example, If children can only demonstrate what they know through language-based measures, we might not have a valid measure of their knowledge because of the way they're influenced by their verbal ability. Fair assessments should be free of bias. If instruments require background knowledge that cannot be assumed, or if they're influenced by cultural differences, or if language differences impact the assessment, then fairness could be an issue. On a normed assessment, understanding who the norming group is very important for determining the fairness of the teachers group. Now let's think about assessment procedures. Each form of assessment has its own procedure: formative and summative, standardized, direct assessments, screening tools, and also our norm and criteria and reference standardized instruments. Training on these are very important because you have to know how the instrument was designed and intended to be used in order to get reliable and valid results. Observational assessment can be more authentic, and teachers can take advantage of the natural occurring of day-to-day activities and instances in which children's strengths come through and their needs are apparent. A lot of information can be gathered. That's not the end of the process. The important next step is thinking about how to make sense of it. To evaluate your choices for aligning your assessment tools to your curriculum and to your goals, you need to think about the following. An assessment should cover most or all of the developmental and early learning domain elements. There should be a balance about what is covered, and you should look for gaps and an overemphasis on some domains compared to others, and be very aware of these. You also need to think about how an assessment should allow children to show increasing skills and learning by including a sequence of items that becomes more challenging over time for children. And so you want to look for that room to grow. You're really trying to capture a range of development, which is very essential. So as we've taken a look at this, we've thought about the different purposes for child observation and assessment. We've thought about the different types of assessment, why child assessment is so important. It really drives how we can do a better job in the classroom for children. It depends on, their learning depends on us and our plans. And then we think about the important terms: reliability, validity. Those are extremely important terms for us to know, the different kinds of assessments that there are, and then of course the processes of using these assessments.